Alright, so I have Mr. Keogh. He is a 25-year-old male. He is 5'8" and weighs about 165 pounds. He is a post-op cabbage patient with no history of a lung disease. He is able to follow commands, and he is a smoker, 1 pack per day for 10 years. So we're approaching Mr. Keogh today, hopefully to wean him off of the ventilator. So I am going to review his chart for any findings, look at his previous vitals throughout the night, his current vent settings. I'm going to wash my hands. Put on my gloves. I'm going to introduce myself to the patient. I am going to check 2 patient identifiers to make sure I'm in the right room. Good morning, Mr. Keogh. Today we are going to try a spontaneous breathing trial on you to try to get you off of this ventilator. I reviewed this chart. He's on the SIMV pressure support with a tidal volume of 600, a respiratory rate of 10, PEEP of 5, FiO2 of 50 with a pressure support of 10. And he seems to be tolerating that well. I'm going to check his vitals. I'm going to listen to breath sounds. And I hear great bilateral breath sounds. I'm going to ask him if he can lift his head off the pillow. He does. He gives me a thumbs up. He does. So my patient, I think my patient is stable enough to be placed on the breathing trial. I'm going to make sure I go and get an order to wean my patient. In the room, I'm going to go approach Mr. Keogh's other medical professional team, his nurse and his doctor. I'm going to talk with the nurse about weaning his sedation down, make sure there's no tube feed running. I'm going to present this patient to the doctor. Hey, Dr. Taylor, I have a 25-year-old male. He is 5'8" and weighs 165 pounds. He's our post-cabbage patient with no history of lung disease. He's following commands. He's got a heart rate of 80, a blood pressure of 110/65, a respiratory rate of 20. His latest blood gas had a pH of 7.38, a CO2 of 42, a O2 of 72, a bicarb of 22, and an SaO2 of 95. He is currently on SIMV pressure support with a tidal volume of 600, a respiratory rate of 10, a PEEP of 5, FiO2 of 50, pressure support of 10. His sputum is clear, thin, and scant. His temperature is 98.7. His blood work all came back pretty normal. His red blood count is 4.5. His hemoglobin's 12. His HCT is 35. His white blood cell count is 10. And his chest X-ray has decreased volumes. Do you think we can get a wean order?
Yes.
Okay. So now I'm going to go back into the room, wash my hands, put on my gloves. I'm going to tell Mr. Keogh that the doctor has went ahead and gave us the okay to try to wean him from the sedation. We have to do a couple weaning parameters on you, so I'm going to educate you through them. Alright, so I'm going to change him into a spontaneous mode on the ventilator. I'm going to back this down to a pressure support of 5, PEEP of 5, and an FiO2 of 30%. A PEEP of 5/5 is like the lowest that we can go. It literally is just making up for the space of the tube. So we have changed him to spontaneous. I'm going to wait a second. He's doing great. I'm going to go to the nymph on here. I'm going to instruct Mr. Keogh to take a big deep breath in and suck as hard as you can, like you're sucking through the straw on 3. 1, 2, 3, suck in, suck in, suck in, suck in as hard as you can, and he gets a negative 40 on his NIF. And then I am going to do the vital capacity on here. Alright, Mr. Keogh, I'm going to need you to take a big deep breath in and blow out until you have no more air. On 3, 1, 2, 3, big deep breath in and blow out hard, hard, hard. Keep blowing, keep blowing, keep blowing, keep blowing. And he does, and he gets 1808 on his vital capacity. His parameters look great. Alright, Mr. Keogh, I'm going to let you breathe on your own here with really no support from the vent. And in a few minutes, I'm going to come back and reassess you, make sure everything still looks great, and then maybe we can get that tube out. He agrees, he's comfortable. I'm going to reassess his vitals, re-listen to his breath sounds. He looks great. I'm going to talk to the nurse, let her know that he is now on his spontaneous breathing trial. Give him his call bell. He says he's great. I'm going to wash my hands. I'm going to go and chart the settings that I put him on, the time we started, his vitals, and how he tolerated being put on the spontaneous breathing trial.